Now, we all would have heard terms like conjunctivitis, pink eye, or here people also use the term called as Madras Eye. Now, what is this pink eye? Should I really be worried about it? Is it harmful? What causes this pink eye? What to do and what not to do when I do get the pink eye? I, Dr. Prarthana Bhandari, Department of Cornea, shall be throwing in some light on this topic to allay your fears and to clear your doubts regarding the same. Now, conjunctivitis or the pink eye is inflammation of the conjunctiva, which is a thin transparent membrane covering the white part of the eye as well as the inner surface of the lids. Now, the most common causes of conjunctivitis is the infectious kind caused by certain bacteria and viruses. Then you've got the allergies, which is caused by dust or pollen. And then the not so common kind, you've got the toxic or the chemical variety, which is caused by exposure to certain chemicals or irritants, as well as exposure to the chlorine in the swimming pools. Now, the infective kind that's caused by the viruses and the bacteria is contagious. That is, it can spread from one eye to the other eye, as also to some other person. Whereas the allergies and the toxic kind are not contagious. Today, I'll be talking to you about the infectious kind because with the onset of the monsoons, we'll be facing this problem more commonly because of increased exposure to contaminated water as well as the increase in the humidity. So what are the symptoms of this pink eye? And the symptoms may vary from redness, watering, a foreign body sensation or a gritty feeling in the eye, discharge, difficulty to open your eyes when you wake up in the morning because of the sticking of the lashes, and in severe cases it may also cause photosensitivity of light as well as blurring of vision. Now, what causes the spread of this infection? Now, it usually occurs when one comes in contact with the discharge or secretions and you accidentally touch your eye without washing your hands. Like in case when you're shaking hands or you touch a contaminated surface or an object, you share your eye makeup or you use old eye makeup. Now, how do we treat this conjunctivitis? Conjunctivitis can be treated with very simple topical medications in the form of eye drops or eye ointments. The best thing to do is visit your nearest eye doctor so that the doctor can give you a detailed eye examination, assess the cause and treat you accordingly. Never buy medications over the counter because this can complicate the problem and delay the healing process. The best thing you can do is to prevent the infection and spread of the infection. Now, what measures do we take to prevent the infection and its spread? First thing, very important, is to maintain good hand hygiene and eye hygiene practices. Now, if you or your child is suffering from an infectious conjunctivitis, it is better to avoid going to school, daycare, common play areas or work. Rest at home so that you do not spread the infection. Do not touch or rub your eyes unnecessarily, and if you do, please wash your hands with soap and water immediately before you touch the other eye or any other surfaces or objects. If your eyes are watering and you're having discharge and you need to wipe your eyes, it's always better and safer to use tissue paper and discard it immediately. Avoid using handkerchiefs because once used and touched to the infected eye, it becomes infective, and keeping the handkerchief here and there could aid in the spread of the infections. Do not share your eye makeup or use any old eye makeup. Avoid using contact lenses when your eyes are red or there is an active infection. And in case you have used contact lenses at the beginning of the infection, it's always better to discard this pair and start off with a fresh pair once your infection's taken care of. It's also very important to not share your eye drops, not to use the same towels or washcloths or face towels, as well as sharing of pillowcases. So conjunctivitis or pink eye, it's not a very serious condition and it's highly treatable and preventable. Very mild cases can heal without treatment as well. However, taking treatment, it reduces the amount of time you or your child are contagious and are having symptoms. The best thing one can do is maintain good ocular hygiene and hand hygiene practices and prevent the spread of the infection to others as well as having a reinfection. Thank you.